Well, for 3 years running now, Singing River Health System has been #1 here on the Gulf Coast in so many different areas. And the major thing is in the health care of people and follow-ups and all that. Well, they've got a great program called Pulsara. And
Right.
David Higton is an RN here at the Singing River Health System at Ocean Springs Hospital. Tell us about this program, if you would. Well, we've talked a little bit about it in the past, but this is great innovation in communications.
It really is. It's a great communication platform. That's really what it is. And it puts all of us on the same page, all of us meaning everybody on the entire care team. So it starts from the field, you know, when ambulances first arrive and they have a patient that looks like they will be either a stroke. This is primarily for stroke patients or cardiac patients, heart attack kind of patients.
Sure.
So as they identify those kind of cases, they can activate the Pulsara app. It's an application that we use it can be on cell phones, it can be on a tablet. We use a tablet here in the nurses station, but most of the nurses have it on their cell phone, and the EMS crews carry it on their cell phone so they can activate the case, give us the information up front. So we get the ball rolling for the patient much faster than we could have before. In fact, just yesterday, we had a patient that Acadian Ambulance picked up in a outlying part of the county. They were able to transmit the information to us along with a picture of the EKG. Each one of the ambulances can actually do a 12-lead EKG in the field. They can take an image of it and transmit it in a secure manner. This is all a HIPAA-compliant, encrypted communication platform.
Yeah.
So we can see that information. Our doctor can make the determination, yeah, this is a heart attack. We need to get going on it right now. So before that patient even arrived yesterday, we had already identified the patient because of the information they sent. We were able to pull that identification out of our system and have them already registered before they arrived. We had the information to the cath lab. The cardiologist had seen it. The entire cath lab had seen the information. We were able to actually bypass the emergency room altogether and just escort the patient from the time they arrived all the way to the cath lab. And the doctor, the cardiologist is putting the catheter in that is the start of their procedure.
Sure.
It was done within, I think, 8 minutes of the patient's arrival yesterday. So that's that much faster that we're able to get the life-saving intervention underway that's needed to help reopen that vessel and restore blood flow to the heart. So we're able to do things.
And that's the difference between life and death.
Life and death. In many cases, we're able to do things much faster. The same type of thing happens for stroke victims. If a stroke victim is picked up by EMS, they're able to transmit that information to us before they arrive. The doctor, in many cases, can go ahead and make the determination whether it's going to be a stroke activation. We have different levels of activation, alphas and bravo strokes. Depending on the situation, we can go ahead and activate all the team members that are responsible for responding to those kind of things. And that way, when the patient gets here, we can hit the ground running. We have to do a certain number of intervention and testing interventions before we can actually enact the life-saving portion of that. We have to get a CT scan within just a few minutes. Our goal is to have it well underway within 20 minutes of the patient's arrival.
Right.
And so they're back into the department, and we are able to determine if it's whether it's a hemorrhagic or an ischemic stroke. There's two major kinds of strokes. It's either bleeding, or which is a hemorrhagic stroke, or it's an occlusive kind of stroke where the vessel is occluded. In which case, we use a medication that we mix right here in the emergency room and can give it within a few minutes. And that reopens, it eats away the clot in the vessel, and it restores the blood flow to your brain. And it keeps you from having a full-blown stroke that you're left debilitated with for the rest of your life.
Right.
So it's a difference in somebody that's fully functioning, able to get up and resume life, or the way it used to be years ago, you know, when you lived in a bed pretty much for the rest of your life and somebody had to take care of you.
Big difference.
Totally. So it's a huge, huge difference. And again, in both of those situations, time is muscle. Time is either heart muscle or it's brain matter. You know, so we say time is brain, time is heart. So it just gives us the opportunity to get the ball rolling that much faster.
Yeah.
You know, we need to get it done for you. And you should see it when those kind of things happen. You should be here. Not that I'm wishing it happens to anybody today, right now.
Hopefully not.
But it's like a NASCAR pit crew. You know, there's multiple people on top of the situation. We're doing all the things that we need to do for you to get you fixed.
Well, we're going to go hop in an ambulance and find
Yeah.
out how this system begins out in the field. Now, Patrick Phillips is EMT with Acadian Services.
Yes, sir.
How are you, sir?
Doing good today.
Tell us a little bit, once you get the call from 911 and you arrive on the scene, tell us what goes on and how you use the Pulsara app.
So we get on the scene and we start evaluating the patient. And AHA, the American Heart Association, has given us guidelines, and we always strive to meet those guidelines with Mission Lifeline. And part of that is we have 10 minutes from the time we get on the scene to get a 12 lead done, like David was talking about earlier. And then after that, we have 10 more minutes to actually transmit that 12 lead to the hospital. So part of those guidelines is the Pulsara app helps us get that done quicker.
Right.
Because the old way we had to be out at the truck to start transmitting, but now we have the new cell phone, and so we can actually transmit this app from inside the house. It's called Pulsara. So we put our information in. It only takes about 30 seconds. So once we do that, we can put the patient's name, birthday, we take a picture of the 12 lead, and it's that quick that we send it off. So we send it off to the hospital, and they get it, and it starts running from there. And the thing is, time is muscle, and so is brain loss, because you can lose over 1 million brain cells a minute. And so they're going away so quick. So the quicker we get you to the hospital, the better. But not only that, but we want the teams here to be ready when we get here.
Right.
And part of that is the more information we can give them, and the sooner we can give them. Because some of these people have to come in. And so the sooner they can get activated, like at 2 a.m., they have to come in, we'd rather have them on their way here to be working. And so,
and on the way back with the patient in the back, you're continuously sending them information through this.
yes, we can. So we start it at the scene. We take the picture on the scene. We get it rolling. If something changes or something, we can log on real quick, and they can even message us back. Hey, we're missing this. Can you send this back? And we can actually communicate back and forth, just like texting.
Right.
There's actually pre-done text messages in it, where we can say, hey, here's the text message. And so we're partnering well with our Singing River system and doing this.
Thank you so much for your time.
No
I
problem.
appreciate that.
All right.
Nice to know you'll be in good hands with this gentleman and with Singing River Health System. Matter of fact, if you go online, you can find out all kinds of information. They've got this wonderful new booklet that is packed full of information on their mission, their core values, and all the different things that they do cover, the different awards that they have, and again, the fact that for 3 years running now, they are #1 on the Gulf Coast with all the services that they do provide for their patients, and also the different employees that they have here that are working with you and your family. So you're always happy to know that you're in great hands with the folks here at Singing River Health System, as well as Acadian Ambulance Service. Again, Patrick, thank you so much, and a thank you to David for sharing all that information with us. So it's great to know that whenever you need them, you're in good hands with Singing River Health System.